Question 1. Comparative studies suggest that patient trust in dental professionals is significantly influenced by the perceived protection of their personal health information. A patient, Mrs. Gable, has just completed a routine dental cleaning. While she is preparing to leave, her adult son, who has accompanied her to all her appointments, asks the dental assistant for details about her oral hygiene habits and any recommended follow-up treatments. Mrs. Gable is present but appears distracted by her phone. What is the most appropriate course of action for the dental assistant? Option A. Tell Mrs. Gable's son that you are unable to discuss her personal health information with him due to privacy regulations, and suggest he speak directly with Mrs. Gable about any concerns he may have. Option B. Briefly explain Mrs. Gable's oral hygiene habits and the recommended follow-up treatments to her son, assuming that since he is her son and has accompanied her to appointments, he has her implicit permission. Option C. Politely inform Mrs. Gable's son that you cannot share any information about her treatment or oral health status without her direct and explicit consent, and then ask Mrs. Gable if she is comfortable with you discussing her care with him. Option D. Share the requested information with Mrs. Gable's son, as he appears to be involved in her care and has been present during previous appointments, indicating a level of implied consent. The correct answer is C. Politely inform Mrs. Gable's son that you cannot share any information about her treatment or oral health status without her direct and explicit consent, and then ask Mrs. Gable if she is comfortable with you discussing her care with him. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's right to privacy and the potential need for information sharing in a healthcare setting. The dental assistant must navigate this delicate balance, prioritizing patient confidentiality as a fundamental ethical and legal obligation. Careful judgment is required to determine when and how information can be shared, ensuring it is done only with explicit consent or when legally mandated. The correct approach represents best professional practice because it upholds the patient's right to privacy, a cornerstone of healthcare ethics, and a legal requirement under regulations governing patient information. Obtaining explicit, informed consent before disclosing any protected health information, FI, is paramount. This aligns with the principles of patient autonomy and trust, fostering a secure environment for dental care. An incorrect approach that involves discussing the patient's treatment with a family member without explicit consent violates patient confidentiality. This is a direct breach of ethical standards and potentially legal regulations, such as HIPAA in the United States, which strictly prohibits the unauthorized disclosure of PHI. Another incorrect approach, sharing details of the patient's medical history with a colleague not directly involved in their care, also constitutes a breach of confidentiality, as it disseminates sensitive information beyond the scope of professional necessity. Finally, assuming consent based on a familial relationship is a critical error. Consent must be explicit and directly from the patient or their legally authorized representative, not inferred. Professionals should employ a decision-making framework that begins with identifying the nature of the information and the request for it. They must then assess whether disclosure is permissible under applicable regulations and ethical guidelines. If disclosure is contemplated, the primary step is to verify the patient's explicit, informed consent. If consent is not obtained or is unclear, the information should not be shared unless there is a clear legal exception, such as a medical emergency requiring immediate intervention or a court order. This systematic approach ensures that patient rights are protected and professional obligations are met. Question 2. Compliance review shows that a dental practice is inconsistently segregating regulated medical waste from general office waste, with some sharps containers being overfilled and some biohazardous materials being disposed of in regular trash bins. What is the most effective approach to address this implementation challenge? Option A. Conduct immediate retraining for all clinical staff on proper waste segregation, labeling, and disposal procedures, followed by a period of close monitoring and regular audits of waste streams. Option B. Advise the office manager to simply remind all staff verbally at the next team meeting about the importance of proper waste disposal. Option C. Issue a written warning to the staff member most frequently observed near the improperly disposed waste and instruct them to be more careful in the future. Option D. Assume the issue is a one-time oversight and focus on other compliance areas, planning to address waste management again during the next scheduled review. Correct answer is A. Conduct immediate retraining for all clinical staff on proper waste segregation, labeling, and disposal procedures, followed by a period of close monitoring and regular audits of waste streams. Explanation. Scenario analysis. This scenario presents a common implementation challenge in dental settings, ensuring consistent and compliant waste management practices across different staff members and over time. The challenge lies in the potential for human error, varying levels of understanding regarding regulations, and the need for ongoing vigilance to maintain safety and environmental standards. Proper judgment is required to identify the root cause of the noncompliance and implement effective, sustainable solutions. Correct approach analysis. The correct approach involves a multifaceted strategy that addresses both immediate corrective action and long-term prevention. This includes retraining staff on specific protocols, reinforcing the importance of proper segregation and disposal, and establishing a system for regular monitoring and feedback. This represents best professional practice because it directly tackles the identified deficiency by educating personnel and implementing oversight, aligning with the principles of maintaining a safe and compliant work environment as mandated by dental assisting regulations. It ensures that all staff are aware of and adhere to the established waste management guidelines, minimizing risks of infection transmission and environmental contamination. Incorrect approaches analysis. One incorrect approach involves simply issuing a verbal warning without further action. This is professionally unacceptable because it fails to address the underlying cause of the noncompliance, which may stem from a lack of knowledge or understanding. It does not provide the necessary education or reinforcement to prevent future errors and could lead to continued breaches of waste management protocols, posing risks to staff and patients. Another incorrect approach is to dismiss the issue as a minor oversight without any corrective measures. This is ethically and regulatorily unsound, as improper waste management can have significant public health and environmental consequences. It demonstrates a lack of commitment to safety standards and could result in penalties or legal repercussions if discovered during an inspection. A third incorrect approach is to blame a specific individual without investigating the systemic issues that may have contributed to the problem. This creates a negative work environment and fails to address potential gaps in training or procedures that affect the entire team. It is unprofessional to single out an individual without a thorough review of the process. Professional reasoning. Professionals should approach such situations by first gathering all relevant information to understand the scope and nature of the noncompliance. This involves reviewing waste disposal logs, observing practices, and speaking with staff. The next step is to identify the root cause, whether it's a training deficit, unclear procedures, or lack of resources. Based on this analysis, a targeted corrective action plan should be developed, which may include retraining, revising protocols, or implementing new monitoring systems. Regular follow-up and feedback are crucial to ensure sustained compliance and foster a culture of safety and responsibility. Question 3. To address the challenge of a patient presenting with subtle, yet concerning, developmental anomalies in their oral structures observed during a routine examination, which of the following actions best aligns with the ethical and regulatory framework for a national entry-level dental assistant, NELDA? Option A. Immediately inform the patient's parents about the potential developmental issues, urging them to seek further specialist consultation without the dentist's direct involvement in the initial communication. Option B. Dismiss the observations as minor variations and proceed with the scheduled cleaning and polishing, assuming they are not significant enough to warrant further attention. Option C. Discuss the observed developmental anomalies with other dental assistants in the break room to get their opinions on what might be happening. Option D. Document the observations thoroughly in the patient's chart, and then discuss them with the supervising dentist to determine the next steps, ensuring the dentist communicates any findings and recommendations to the patient or their guardian. The correct answer is D. Document the observations thoroughly in the patient's chart, and then discuss them with the supervising dentist to determine the next steps, ensuring the dentist communicates any findings and recommendations to the patient or their guardian. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a dental assistant is privy to information about a patient's developing oral structures that could have significant implications for their future oral health. The challenge lies in balancing the patient's right to privacy and autonomy with the dental assistant's professional responsibility to advocate for the patient's well-being, especially when potential long-term issues are identified during routine care. The assistant must navigate the complexities of reporting, patient consent, and the scope of practice for an entry-level dental assistant without overstepping boundaries or causing undue alarm. Correct approach analysis. The correct approach prioritizes patient-centered care and adherence to professional ethical guidelines. By documenting observations accurately and discussing them with the supervising dentist, the assistant fulfills their duty to report findings within the scope of their role. This ensures that the dentist, who has the ultimate responsibility for diagnosis and treatment planning, is fully informed. Subsequently, involving the patient in a discussion about the findings, facilitated by the dentist, respects patient autonomy and allows for informed decision-making regarding further evaluation or management. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their own health. Incorrect approach is analysis. One incorrect approach involves immediately informing the patient's parents without consulting the supervising dentist. This violates patient privacy, especially if the patient is a minor and the parents are not the designated guardians, or if the patient is an adult. It also bypasses the dentist's professional judgment and diagnostic authority, potentially causing unnecessary anxiety or misinterpretation of findings. This action could be considered a breach of professional conduct and potentially violate patient confidentiality regulations. Another incorrect approach is to ignore the findings due to a lack of understanding or fear of overstepping. This is a failure of the assistant's duty to observe and report, potentially compromising the patient's long-term oral health by delaying necessary interventions. It neglects the principle of beneficence and demonstrates a lack of professional responsibility. A third incorrect approach is to discuss the findings with colleagues or other dental professionals not directly involved in the patient's care. This constitutes a breach of patient confidentiality and violates ethical standards. It also undermines the professional relationship between the dental team and the patient. Professional reasoning. Professionals should follow a systematic decision-making process. First, observe and accurately document all findings within the scope of practice. Second, consult with the supervising dentist to discuss observations and seek guidance. Third, understand the dentist's role in diagnosis and treatment planning. Fourth, respect patient confidentiality and autonomy, ensuring that any communication with the patient or their guardians is done appropriately and with the dentist's involvement. Finally, always act in the best interest of the patient while adhering to all applicable regulations and ethical codes. Question 4. Governance review demonstrates a need to reinforce foundational dental anatomy knowledge among entry-level dental assistants. A patient presents with a tooth that has a broad, flat chewing surface with multiple cusps located posterior to the canine. Based on its morphology and typical location, which of the following tooth types is this most likely to be? Option A, canine. Option B, premolar. Option C, incisor. Option D, molar. The correct answer is D, molar. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting where accurate identification of tooth types is crucial for effective patient care and documentation. Misidentification can lead to incorrect treatment planning, charting errors, and ultimately compromised patient outcomes. The challenge lies in the subtle differences between tooth types, especially in younger patients or when teeth are partially erupted or have undergone wear. Correct approach analysis. The correct approach involves systematically examining the tooth's morphology, including its shape, size, and function, to accurately classify it as an incisor, canine, premolar, or molar. This aligns with the fundamental knowledge expected of a national entry-level dental assistant, NELDA, as outlined in their scope of practice, which requires understanding basic dental anatomy. Proper identification ensures accurate charting, aids in communication with the dentist, and supports appropriate procedure selection. This is a core competency that underpins safe and effective dental practice. Incorrect approach is analysis. One incorrect approach would be to rely solely on the tooth's position in the arch without considering its morphology. This is a failure because position alone is not definitive. For example, a premolar might be in a position where a canine is typically found due to developmental anomalies. This approach lacks the detailed anatomical understanding required by NELDA standards and could lead to significant charting errors. Another incorrect approach would be to guess the tooth type based on a general impression of its size. This is a significant ethical and regulatory failure. Dental charting and treatment planning are precise processes. Guessing introduces an unacceptable level of uncertainty and unprofessionalism, violating the NELDA responsibility to provide accurate assistance. It demonstrates a lack of diligence and a disregard for the importance of precise anatomical knowledge. Further incorrect approach would be to assume all posterior teeth are molars without differentiating between premolars and molars. This is a failure to adhere to the detailed anatomical classification required. Premolars and molars have distinct functions and morphologies, and their accurate identification is essential for diagnosis and treatment. This oversight indicates a superficial understanding of dental anatomy, falling short of the NELDA expected competency level. Professional reasoning. Professionals should approach tooth identification by first observing the tooth's location within the dental arch. Then they must carefully examine its crown shape, including the presence of cusps, ridges, and incisal edges. The primary function of the tooth, cutting, tearing, grinding, is also a key indicator. By integrating these observations, a dental assistant can confidently and accurately classify the tooth type, ensuring precise documentation and supporting the dentist's treatment decisions. This systematic, morphology-driven approach is the bedrock of accurate dental charting and patient care. Question 5. Risk assessment procedures indicate that during a routine dental procedure, a dental assistant accidentally drops a sterile instrument onto the floor. The supervising dentist is actively engaged in the procedure and has not yet noticed the incident. What is the most appropriate immediate action for the dental assistant to take? Option A. Retrieve the instrument and place it directly into the sharps container for disposal without informing the dentist. Option B. Quickly pick up the instrument, attempt to wipe it clean with a disposable wipe, and discreetly place it back into the sterile field. Option C. Continue assisting the dentist as if the incident did not occur, hoping the dentist does not notice the dropped instrument. Option D. Immediately retrieve the instrument, inform the supervising dentist of the contamination, and request a new sterile instrument to continue the procedure. Correct answer is D. Immediately retrieve the instrument, inform the supervising dentist of the contamination, and request a new sterile instrument to continue the procedure. Explanation. This scenario is professionally challenging because it requires the dental assistant to balance immediate patient care with strict adherence to infection control protocols, which are paramount for preventing disease transmission and ensuring a safe healthcare environment. The dental assistant must make a rapid, informed decision based on their understanding of established safety guidelines. The correct approach represents best professional practice because it prioritizes patient and staff safety by immediately addressing the potential breach in sterile technique. This aligns with the fundamental principles of infection control, which are heavily emphasized in entry-level dental assistant training and regulatory frameworks. Specifically, it upholds the Centers for Disease Control and Prevention (CDC) guidelines for infection control in dental settings, which mandate the proper handling and disposal of contaminated instruments and the re-establishment of a sterile field. Ethically, this approach demonstrates a commitment to patient well-being and professional responsibility. An incorrect approach that involves continuing the procedure without addressing the contaminated instrument fails to adhere to established infection control protocols. This poses a significant risk of cross-contamination, potentially exposing the patient and other individuals to infectious agents. This directly violates regulatory requirements for maintaining a sterile field and handling contaminated materials, leading to ethical breaches in patient care and professional conduct. Another incorrect approach, such as attempting to quickly rinse the instrument and reuse it, demonstrates a misunderstanding of sterilization and disinfection principles. Instruments that have contacted a sterile field and then been contaminated require proper reprocessing, not a superficial cleaning. This action would be a direct violation of regulatory standards for instrument reprocessing and would compromise patient safety. Finally, an incorrect approach that involves ignoring the incident and hoping it goes unnoticed is a severe ethical and professional failing. It demonstrates a lack of accountability and a disregard for the safety of others. This behavior undermines the integrity of the dental practice and can have serious consequences for patient health and regulatory compliance. The professional decision-making process for similar situations involves a systematic approach. 1. Recognize the potential breach. Immediately identify any deviation from sterile technique or established safety protocols. 2. Assess the risk. Evaluate the potential for transmission of infectious agents based on the nature of the contamination and the procedure being performed. 3. Take immediate corrective action. Implement the necessary steps to mitigate the risk, which may include discarding contaminated items, re-sterilizing instruments, or re-establishing a sterile field. 4. Communicate and document. Inform the supervising dentist and document the incident and the corrective actions taken, as per practice policy and regulatory requirements. 5. Learn and adapt. Use the incident as a learning opportunity to reinforce proper techniques and prevent future occurrences. Question 6. Market research demonstrates that patients often have questions about the role of saliva in maintaining oral health. A patient expresses concern about experiencing a dry mouth and asks, "What exactly do these salivary glands do and why is saliva important?" Option A. Salivary glands are responsible for producing mucus that helps break down food, and if you're feeling dry, you might have a blockage that needs immediate attention. Option B. Salivary glands are primarily for making your mouth feel wet, and if it's dry, you should drink more water and avoid sugary drinks. Option C. Salivary glands are tiny organs that secrete enzymes to fight off infections, and your dry mouth could be a sign of a serious underlying condition. Option D. Salivary glands produce saliva, which is essential for lubricating the mouth, aiding in digestion, and helping to neutralize acids, thereby protecting your teeth from decay. The correct answer is D. Salivary glands produce saliva, which is essential for lubricating the mouth, aiding in digestion, and helping to neutralize acids, thereby protecting your teeth from decay. Explanation. Scenario analysis. This scenario presents a professional challenge because a dental assistant must accurately relay information about salivary gland functions to a patient who is experiencing discomfort. Misinformation could lead to patient anxiety, incorrect self-care, or delayed seeking of appropriate professional advice. The dental assistant's role is to support the dentist and provide clear, accurate patient education within their scope of practice, requiring a nuanced understanding of both the anatomy and physiology of salivary glands and the limitations of their own role. Correct approach analysis. The correct approach involves explaining that salivary glands produce saliva, which aids in digestion, lubricates the mouth, and helps neutralize acids, thereby protecting teeth. This explanation is accurate, directly addresses the patient's likely concern about dry mouth or discomfort, and stays within the scope of practice for an entry-level dental assistant by providing foundational knowledge without diagnosing or recommending specific medical treatments. This aligns with the NELDA framework's emphasis on patient education and support. Incorrect approaches analysis. One incorrect approach would be to diagnose the cause of the patient's discomfort, such as suggesting a specific infection or blockage. This is a regulatory failure, as diagnosis is outside the scope of practice for a dental assistant. Another incorrect approach would be to recommend over-the-counter medications or home remedies without consulting the dentist. This constitutes an ethical and regulatory failure by practicing dentistry without a license and potentially providing inappropriate advice. A third incorrect approach would be to dismiss the patient's concerns or provide vague, unhelpful information. This fails to meet the ethical obligation of providing competent patient care and education, potentially leading to patient dissatisfaction and a lack of trust. Professional reasoning. When faced with a patient inquiry about a physiological function related to their oral health, a dental assistant should first listen attentively to the patient's concerns. They should then access their knowledge base regarding the relevant anatomy and physiology, ensuring the information is accurate and relevant to the patient's situation. If the patient's concern suggests a potential pathology or requires a diagnosis or treatment plan, the dental assistant's professional responsibility is to inform the dentist immediately and refrain from offering personal opinions or advice beyond their scope of practice. Patient education should always be clear, concise, and factually correct, reinforcing the dentist's treatment plan and promoting patient understanding and compliance. Question 7. Consider a scenario where the dentist asks you to prepare a specific dental material for a Class Roman II composite restoration. You retrieve the material, but as you are about to dispense it, you notice it is a type typically used for direct pulp capping. Which of the following actions best demonstrates adherence to professional standards and patient safety? Option A. Confirm with the dentist that the material is indeed the correct one for the composite restoration, or if a different material is intended. Option B. Select a different material that is commonly used for Class Roman II composite restorations, assuming the dentist made a mistake. Option C. Proceed with using the material, assuming the dentist knows what they are doing and has a specific reason for requesting it. Option D. Inform the dentist that the material is not suitable for composite restorations and ask them to select the correct one. Correct answer is A. Confirm with the dentist that the material is indeed the correct one for the composite restoration, or if a different material is intended. Explanation. This scenario is professionally challenging because it requires the dental assistant to accurately identify and select the appropriate dental material based on the dentist's instructions and the specific clinical need, while adhering to strict infection control protocols. Misidentification or improper selection of materials can lead to treatment failure, patient discomfort, and potential harm, necessitating a thorough understanding of material properties and applications. The correct approach represents best professional practice because it prioritizes patient safety and treatment efficacy by ensuring the correct material is used for the intended purpose. This aligns with the fundamental ethical obligation of dental professionals to provide competent and safe care. Adhering to the dentist's specific instructions and verifying the material's suitability for the procedure demonstrates diligence and a commitment to quality patient care, which are implicit requirements of professional conduct within the dental assisting scope of practice. An incorrect approach of selecting a material based solely on its common use for a general category of restoration, without confirming the specific type requested by the dentist, is a significant ethical and professional failure. This bypasses direct professional instruction and introduces a risk of using an inappropriate material, potentially compromising the restoration's integrity and the patient's oral health. Such an action could be considered negligence, as it deviates from the standard of care expected of a dental assistant who must follow the dentist's directives precisely. Another incorrect approach of choosing a material that is readily available or easier to handle, irrespective of the dentist's specific requirement, demonstrates a lack of professionalism and a disregard for the treatment plan. This prioritizes convenience over patient well-being and the dentist's clinical judgment, which is a serious ethical breach. It suggests a failure to understand the critical role of material selection in successful dental treatment. Finally, an incorrect approach of assuming the dentist meant a different material because the requested one is less commonly used for that specific situation is also professionally unacceptable. While critical thinking is valued, making assumptions about the dentist's intent without clarification can lead to errors. The professional responsibility is to seek clarification from the dentist if there is any doubt, rather than proceeding with an assumption that could compromise the treatment. The professional decision-making process in such situations involves a clear understanding of the dentist's instructions, knowledge of various dental materials and their applications, and a commitment to patient safety. When faced with a material selection task, a dental assistant should 1. Listen carefully to the dentist's instructions and note the specific material requested. 2. If unsure about the material or its application, politely ask for clarification from the dentist. 3. Verify the selected material against the dentist's request before dispensing it. 4. Ensure the material is within its expiration date and properly stored. Question 8. The investigation demonstrates that when presented with a radiograph of a posterior tooth, a dental assistant must accurately identify its anatomical classification and key features to assist the dentist effectively. If the radiograph clearly shows a large tooth with multiple cusps and evidence of root division, which of the following descriptions most accurately reflects its dental anatomy? Option A. A maxillary canine, distinguished by its single, prominent cusp and conical root. Option B. A maxillary first molar characterized by its broad occlusal surface, typically 4 cusps, 2 buccal, 2 lingual, and a trifurcation of roots. Option C. A mandibular second premolar, typically having 1 or 2 cusps and a single root. Option D. A mandibular first molar, identifiable by its broader buccal surface, usually 5 cusps and a bifurcation of roots. The correct answer is B. A maxillary first molar, characterized by its broad occlusal surface, typically 4 cusps, 2 buccal, 2 lingual, and a trifurcation of roots. Explanation. The investigation demonstrates the critical need for a dental assistant to possess a foundational understanding of dental anatomy to effectively assist the dentist and ensure patient safety. This scenario is professionally challenging because misidentifying anatomical structures can lead to incorrect treatment planning, instrument selection, and potentially patient harm. Careful judgment is required to accurately identify and describe the tooth and its surrounding structures. The correct approach represents best professional practice because it demonstrates an accurate recall and application of dental anatomy knowledge. Specifically, identifying the maxillary first molar and its key anatomical features, such as the buccal and lingual cusps and the furcation, is essential for procedures like charting, taking radiographs, or preparing for restorative work. This aligns with the general principles of competency and diligence expected of a dental assistant, ensuring they can communicate effectively with the dentist and contribute to accurate patient care. While specific NELDA regulations might not detail every anatomical landmark, the overarching requirement for competent practice necessitates this level of knowledge. An incorrect approach that misidentifies the tooth as a premolar fails to recognize the distinct characteristics of molars, such as the number of cusps and roots. This demonstrates a lack of fundamental anatomical knowledge, which could lead to errors in diagnosis or treatment. Ethically, this failure breaches the duty of care owed to the patient by not performing at the expected level of competence. Another incorrect approach that identifies the tooth but fails to note the presence of a furcation, or incorrectly describes its location, indicates an incomplete understanding of the tooth's morphology. The furcation is a critical area for periodontal health and instrumentation, and its accurate identification is vital for effective dental hygiene and treatment. Failing to recognize or accurately describe this feature can compromise patient care and potentially lead to complications. This represents a failure in professional responsibility to be thorough and accurate in patient assessment. The professional decision-making process for similar situations should involve a systematic approach to identifying dental structures. This includes observing the tooth's location in the arch, its shape, the number of cusps, and the presence of roots or furcations. If unsure, the dental assistant should consult anatomical charts, textbooks, or, most importantly, seek clarification from the supervising dentist. This iterative process of observation, recall, and verification ensures accuracy and upholds the highest standards of patient care, adhering to the implicit ethical and professional obligations of a dental assistant. Question 9. Upon reviewing a periapical radiograph of the mandibular anterior region, the dental assistant observes a small, radiolucent, often oval-shaped landmark located near the apices of the premolars. This landmark is crucial for surgical procedures and nerve blocks in this area. What is the most accurate identification of this radiographic anatomical landmark? Option A, mandibular canal. Option B, mental foramen. Option C, genial tubercles. Option D, external oblique ridge. The correct answer is B, mental foramen. Explanation: this scenario presents a professional challenge because accurately identifying radiographic anatomy is fundamental to providing safe and effective dental care. Misinterpreting anatomical landmarks on a radiograph can lead to incorrect diagnoses, inappropriate treatment planning, and potentially harm to the patient. The dental assistant's role in recognizing these structures is crucial for supporting the dentist's diagnostic process. Careful judgment is required to distinguish between normal anatomical variations and pathological findings, ensuring that all relevant structures are considered. The correct approach represents best professional practice because it demonstrates a thorough understanding of normal radiographic anatomy, which is a core competency for a dental assistant. By correctly identifying the mental foramen, the assistant is ensuring that this important landmark is noted, preventing potential misinterpretation as pathology, and facilitating accurate assessment of the surrounding structures, such as the mandibular canal. This aligns with the ethical obligation to provide competent care and support the dentist's diagnostic efforts, adhering to the principles of patient safety and quality assurance expected within the dental profession. An incorrect approach that fails to identify the mental foramen, or misidentifies it, represents a significant regulatory and ethical failure. Such an error could lead to the mental foramen being overlooked or mistaken for a carious lesion or periapical pathology, potentially resulting in unnecessary further investigations or incorrect treatment. This directly violates the duty of care owed to the patient and falls short of the expected standard of competence for a dental assistant. Furthermore, it could lead to a breach of professional conduct if it contributes to diagnostic errors or patient harm. Another incorrect approach that focuses solely on the teeth without considering surrounding anatomical structures demonstrates a lack of comprehensive radiographic interpretation. While teeth are the primary focus of many dental radiographs, understanding the context of adjacent bone and soft tissue anatomy is essential for a complete assessment. Failing to acknowledge or correctly identify key anatomical landmarks like the mental foramen can lead to an incomplete or inaccurate understanding of the radiographic image, potentially missing critical diagnostic information. The professional decision-making process for similar situations should involve a systematic review of the radiograph, starting with identifying all relevant anatomical landmarks. This includes structures like the mental foramen, mandibular canal, genial tubercles, and the overall bone density and texture. The dental assistant should then correlate these findings with the patient's clinical presentation and the reason for the radiograph. If any uncertainty exists regarding the identification of anatomical structures or potential pathology, the assistant has an ethical and professional responsibility to consult with the supervising dentist. This collaborative approach ensures that all information is accurately interpreted and contributes to optimal patient care. Question 10. Quality control measures reveal that a new dental assistant has been documenting patient-occlusal relationships using inconsistent and sometimes vague terminology. During a review of patient charts, it was noted that the assistant described one patient's bite as a little off and another's as the top teeth stick out a bit. The supervising dentist has asked for an assessment of the assistant's understanding of dental arches and occlusion, specifically regarding how to accurately record these findings. Option A. Record the occlusal findings based on a general understanding of dental arches without specific reference to established classifications or deviations, focusing on the overall alignment of the teeth. Option B. Document the patient's occlusion using subjective descriptions that reflect the general appearance of the bite, such as crowded teeth or uneven bite, to convey a general impression to the dentist. Option C. Note that the patient's occlusion appears normal unless there are obvious signs of malocclusion, such as missing teeth or significant gaps, and otherwise leave the occlusal assessment section of the chart blank. Option D. Accurately classify the patient's occlusion using established dental terminology, e.g., Class I, Class Roman II, Class Roman III, and describe any significant deviations from ideal occlusion, such as overjet, overbite, or crossbite, in the patient's chart. The correct answer is D. Accurately classify the patient's occlusion using established dental terminology, e.g., Class I, Class Roman II, Class Roman III, and describe any significant deviations from ideal occlusion, such as overjet, overbite, or crossbite, in the patient's chart. Explanation. This scenario presents a professional challenge because it requires the dental assistant to accurately interpret and document occlusal relationships based on clinical observation, which directly impacts treatment planning and patient care. The NELDA certification emphasizes foundational knowledge and skills, including understanding dental arches and occlusion, as these are critical for assisting the dentist effectively and ensuring patient safety and accurate record keeping. The correct approach represents best professional practice because it aligns with the fundamental principles of dental assisting and the expected scope of practice for an entry-level assistant. Accurately identifying and describing the patient's occlusal classification, e.g., Class I, Class Roman II, Class Roman III, and noting any deviations from ideal occlusion, e.g., crossbite, overjet, overbite, is a core competency. This information is vital for the dentist to diagnose potential issues, develop a treatment plan, and monitor progress. Adhering to established terminology and documentation standards ensures clear communication within the dental team and maintains accurate patient records, which is a regulatory expectation for all healthcare professionals. An incorrect approach that involves guessing or using vague descriptions is professionally unacceptable. This demonstrates a lack of understanding of occlusal principles and a failure to meet the expected standard of care. Such inaccuracies can lead to misdiagnosis, inappropriate treatment, and potentially harm to the patient. Furthermore, it violates ethical obligations to provide competent care and maintain accurate records. Another incorrect approach, such as documenting findings without understanding their significance, shows a lack of critical thinking and engagement with the clinical information. This passive approach fails to contribute meaningfully to patient care and can be seen as a dereliction of professional duty. Finally, an approach that involves fabricating or altering findings is a severe ethical and regulatory violation, constituting fraud and jeopardizing patient trust and safety. The professional decision-making process for similar situations involves a systematic approach. First, thoroughly observe the patient's occlusion, paying attention to the relationship of the maxillary and mandibular teeth in centric relation and functional movements. Second, apply knowledge of occlusal classifications and terminology to categorize the observed relationships. Third, accurately and objectively document these findings using precise dental language. If unsure, the professional decision-making process dictates seeking clarification or guidance from the supervising dentist before documenting or proceeding. This ensures accuracy, competence, and adherence to professional standards. Question 11. Upon reviewing the dental treatment plan for a patient requiring a new crown, the dentist asks you to prepare the necessary materials. You are presented with a selection of materials including a light-cured composite resin, a polyvinyl siloxane, PVS impression material, and a dental dam. Considering the distinct roles of restorative, impression, and auxiliary materials, which of the following accurately categorizes these items in relation to the upcoming crown preparation and fabrication? Option A. Composite resin is an impression material, polyvinyl siloxane is a restorative material, and dental dam is an auxiliary material. Option B. Composite resin is an impression material, polyvinyl siloxane is an auxiliary material, and dental dam is a restorative material. Option C. Composite resin is an auxiliary material, polyvinyl siloxane is a restorative material, and dental dam is an impression material. Option D. Composite resin is a restorative material, polyvinyl siloxane is an impression material, and dental dam is an auxiliary material. The correct answer is D. Composite resin is a restorative material, polyvinyl siloxane is an impression material, and dental dam is an auxiliary material. Explanation. This scenario presents a common challenge in a dental assisting role, selecting the appropriate materials for a procedure based on their properties and intended use. The professional challenge lies in understanding the distinct functions of restorative, impression, and auxiliary materials and how their misuse can impact patient care, procedural success, and compliance with dental practice standards. Careful judgment is required to ensure the correct material is chosen for the intended purpose, preventing potential complications and ensuring efficient workflow. The correct approach involves accurately identifying the material's classification and its role in the dental procedure. Restorative materials are designed to fill cavities and restore tooth structure. Impression materials capture the precise shape of oral structures for prosthetics or restorations, and auxiliary materials support these primary functions. Selecting the correct material aligns with the dentist's treatment plan and adheres to the principles of proper dental material handling and application, which are fundamental to patient safety and the efficacy of dental treatment. This directly supports the NELDA scope of practice by ensuring competent assistance in material selection and handling. An incorrect approach would be to confuse the categories of dental materials or to use a material for a purpose it is not designed for. For instance, using an impression material as a temporary restorative material would be a significant failure. Impression materials are not designed for intraoral use as a filling, lack the necessary strength and durability, and could leach harmful substances or be ingested by the patient. This constitutes a direct violation of patient safety protocols and potentially negligent practice, falling outside the scope of a NELDA responsibilities. Similarly, using a restorative material for taking an impression would yield inaccurate results, compromising the fabrication of any subsequent dental prosthetics or restorations and leading to treatment failure. This demonstrates a lack of understanding of material properties and their specific applications, which is a core competency expected of a dental assistant. The professional decision-making process for similar situations should involve a systematic evaluation of the material's intended use as per manufacturer guidelines and dental protocols. A dental assistant should always confirm the specific requirements of the procedure with the supervising dentist, understanding the fundamental differences between restorative, impression, and auxiliary materials and their respective properties, e.g., setting time, strength, accuracy, biocompatibility, is crucial. When in doubt, seeking clarification from the dentist or referring to established dental practice guidelines is paramount to ensuring patient safety and procedural integrity. Question 12. Performance analysis shows that entry-level dental assistants must possess a foundational understanding of the temporomandibular joint, TMJ, anatomy to effectively assist in patient care and education. Which of the following accurately describes the primary bony components that form the articulation of the temporomandibular joint? Option A. The mandibular fossa and the alveolar process of the maxilla. Option B. The condyle of the mandible and the coronoid process. Option C. the mandibular fossa and articular tubercle of the temporal bone and the condyle of the mandible. Option D, the zygomatic arch and the mastoid process. Correct answer is C, the mandibular fossa and articular tubercle of the temporal bone and the condyle of the mandible. Explanation. Scenario analysis. This scenario is professionally challenging because accurately identifying and describing anatomical structures of the temporomandibular joint, TMJ, is fundamental to providing safe and effective dental care. Misidentification can lead to incorrect patient education, improper instrument selection, or misinterpretation of diagnostic information, all of which can compromise patient outcomes and potentially lead to harm. The NELDA certification emphasizes foundational knowledge, making precise anatomical understanding a critical competency. Correct approach analysis. The correct approach involves accurately identifying the primary bony components of the TMJ, which are the mandibular fossa and the articular tubercle of the temporal bone, and the condyle of the mandible. This aligns with the foundational anatomical knowledge expected of an entry-level dental assistant. Understanding these core structures is essential for comprehending joint function, common pathologies, and the rationale behind various dental procedures that may affect the TMJ. This knowledge directly supports the assistant's role in patient care, documentation, and assisting the dentist. Incorrect approaches analysis. One incorrect approach involves focusing on structures not directly part of the TMJ articulation, such as the zygomatic arch, the mastoid process. While these are adjacent anatomical landmarks, they do not form the articulating surfaces of the TMJ. This demonstrates a lack of precise anatomical knowledge, which could lead to confusion during patient communication or when assisting with procedures. Another incorrect approach might be to include soft tissues like muscles or ligaments as the primary bony components. While these are crucial for TMJ function, the question specifically asks for the bony components that form the joint itself. This indicates a misunderstanding of the core anatomical definition of the joint. A further incorrect approach could be to list only one bony component, such as just the condyle, without acknowledging the corresponding articulating surface on the temporal bone. This shows an incomplete understanding of how the joint is formed. These errors reflect a failure to meet the basic anatomical competency standards required for NELDA certification and could lead to professional errors in practice. Professional reasoning. Professionals should approach anatomical identification by first recalling the definition of the joint and its primary articulating surfaces. They should then systematically identify the key bony structures involved. When faced with uncertainty, consulting reliable anatomical references, such as textbooks or anatomical models approved for dental assistant education, is a critical step. Understanding the why behind anatomical knowledge, how it relates to patient care, procedures, and potential issues reinforces learning and promotes accurate application. This systematic and evidence-based approach ensures that the assistant provides accurate information and support to the dental team and the patient. Question 13. Compliance review shows that during a recent intraoral radiographic procedure, a national entry-level dental assistant, NELDA, observed the supervising dentist consistently positioning the X-ray beam incorrectly, resulting in significant cone cutting on multiple images. The assistant is concerned about the diagnostic quality of these radiographs and the potential for retakes, which increases patient radiation exposure. What is the most appropriate immediate course of action for the NELDA? Option A. Discreetly and professionally inform the supervising dentist of the observation regarding the cone cutting and express concern about diagnostic quality. Option B. Immediately contact the state dental board to report the dentist's radiographic technique. Option C. Ignore the observation, assuming the dentist is aware and will correct it later to avoid potential conflict. Option D. Discuss the dentist's technique with other dental staff members to seek their opinion on how to proceed. The correct answer is A. Discreetly and professionally inform the supervising dentist of the observation regarding the cone cutting and express concern about diagnostic quality. Explanation. This scenario presents an ethical dilemma common in dental radiography, requiring a dental assistant to balance patient care, professional integrity, and regulatory compliance. The challenge lies in the assistant's direct observation of a potential violation of standard practice, which could impact patient safety and diagnostic accuracy, while also navigating the professional relationship with the supervising dentist. Careful judgment is required to address the situation appropriately without overstepping boundaries or compromising patient well-being. The correct approach involves discreetly and professionally communicating concerns to the supervising dentist. This upholds best professional practice by prioritizing patient safety and diagnostic quality. It aligns with the ethical obligation to act in the patient's best interest and the professional responsibility to maintain high standards of care. By addressing the issue directly with the dentist, the assistant respects the hierarchical structure of the dental team while ensuring that potential errors are identified and corrected. This approach also adheres to the principles of open communication and collaborative problem-solving within the dental practice, which are crucial for maintaining a safe and effective environment. An incorrect approach would be to ignore the observation. This failure to act would violate the ethical duty to advocate for the patient and could lead to compromised diagnostic information, potentially resulting in incorrect treatment plans. It also fails to uphold professional standards for radiography. Another incorrect approach would be to immediately report the supervising dentist to a regulatory body without first attempting to resolve the issue internally. While reporting is a necessary step if concerns are not addressed, bypassing the direct communication with the dentist is unprofessional and can damage the working relationship unnecessarily. It also fails to provide the dentist with an opportunity to correct their practice, which might be due to an oversight rather than intentional misconduct. A third incorrect approach would be to discuss the observation with other staff members or patients. This constitutes a breach of patient confidentiality and professional decorum. It undermines the trust within the dental team and could lead to gossip and a negative work environment. Without constructively addressing the radiographic issue, the professional decision-making process for similar situations involves a tiered approach. First, assess the immediate risk to the patient. Second, if there is a concern, attempt to address it directly and professionally with the individual involved, in this case, the supervising dentist. Third, if the issue is not resolved or if there is a significant ongoing risk, escalate the concern through appropriate channels, which may include practice management or, if necessary, the relevant regulatory authority. This process emphasizes communication, problem-solving, and patient advocacy. Question 14. Analysis of the legal and ethical considerations when a dental assistant is preparing to take intraoral radiographs for a patient who has not explicitly consented to imaging beyond the immediate diagnostic need, and the practice policy requires documentation of all procedures. Option A. Inform the patient that radiographs are required for their treatment and proceed without further consent discussion, as it is a routine part of dental care. Option B. Take the radiographs as they are standard diagnostic tools, assuming the patient's presence in the office implies consent for necessary imaging. Option C. Explain the radiographic procedure to the patient, obtain their written informed consent specifically for the imaging, and document this consent in the patient's electronic health record before taking the radiographs. Option D. Proceed with taking the radiographs after verbally confirming the patient understands the need for imaging, and document the verbal confirmation in the patient's chart. The correct answer is D. Proceed with taking the radiographs after verbally confirming the patient understands the need for imaging, and document the verbal confirmation in the patient's chart. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing patient privacy rights with the need for accurate record-keeping and potential legal or insurance verification. The dental assistant must navigate the ethical obligation of confidentiality against the practical requirements of documenting a procedure that may have implications beyond the immediate clinical encounter. Careful judgment is required to ensure compliance with all applicable regulations and ethical standards. Correct approach analysis. The correct approach involves obtaining explicit, informed consent from the patient for the radiographic procedure, clearly explaining its purpose, and documenting this consent in the patient's record. This aligns with the principles of patient autonomy and informed consent, which are fundamental ethical and legal considerations in healthcare. In the U.S., the Health Insurance Portability and Accountability Act, HIPAA, mandates patient privacy and the right to control their health information, including diagnostic images. Obtaining consent ensures that the patient understands and agrees to the use of their radiographic images, protecting their privacy rights while allowing for necessary clinical documentation. Incorrect approaches analysis. Failing to obtain consent and proceeding with radiography violates patient autonomy and privacy rights, potentially breaching HIPAA regulations. This approach disregards the patient's right to know and control the use of their personal health information. Obtaining only verbal consent without documentation is insufficient. While verbal consent may be permissible in some limited clinical contexts, for diagnostic imaging, especially when there might be future uses or disclosures of the images, written or clearly documented consent is best practice and often legally required to provide a verifiable record of agreement. This lack of documentation leaves both the patient and the practice vulnerable. Assuming consent based on the patient's presence in the dental office is a significant ethical and legal failing. Patient presence does not automatically imply consent for all procedures, particularly those involving diagnostic imaging with potential for broader use or disclosure. This assumption disregards the explicit requirement for informed consent for medical procedures. Professional reasoning. Dental assistants should always prioritize obtaining informed consent for radiographic procedures. This involves a clear explanation of the procedure, its purpose, potential risks and benefits, and how the images will be used and stored. Documentation of this consent in the patient's record is crucial. When in doubt about consent requirements or specific documentation protocols, consulting with the supervising dentist or the practice's compliance officer is the appropriate course of action. Question 15. Stakeholder feedback indicates that entry-level dental assistants sometimes struggle with the dynamic nature of assisting in restorative procedures like fillings, crowns, and bridges. Specifically, there's a concern about how assistants manage instrument selection, material preparation, and patient comfort simultaneously while maintaining a sterile field. Considering the NELDA regulatory framework, which approach best demonstrates the expected competency of an entry-level dental assistant during a crown preparation procedure. Option A. Wait for the dentist to verbally request each specific instrument and material as needed, and only provide suction when the dentist explicitly asks for it, prioritizing the dentist's direct instructions over anticipating needs. Option B. Focus primarily on patient comfort by engaging in extended conversation during the procedure, and only retrieve instruments and materials when the dentist expresses frustration or directly asks for them. Option C. Select and prepare all instruments and materials for the entire crown preparation sequence before the dentist begins, and then focus solely on suctioning and retracting the patient's cheek throughout the procedure. Option D. Prepare a basic set of instruments for crown preparation. Anticipate the dentist's immediate needs for burrs and impression materials. Maintain effective suction to clear debris and moisture, and offer the correct materials for temporary or permanent cementation as the procedure progresses. The correct answer is C. Select and prepare all instruments and materials for the entire crown preparation sequence before the dentist begins, and then focus solely on suctioning and retracting the patient's cheek throughout the procedure. Explanation. This scenario is professionally challenging because it requires the dental assistant to balance the dentist's immediate needs with the patient's comfort and safety, all while adhering to strict infection control protocols. The assistant must anticipate the dentist's next steps, select the correct instruments and materials, and maintain a clear operating field without compromising patient well-being or violating established dental practice guidelines. The correct approach represents best professional practice because it prioritizes patient safety and infection control, which are paramount in dental assisting. This involves meticulous instrument preparation, proper material handling, and effective suctioning to minimize aerosolization and patient discomfort. Adhering to these protocols ensures compliance with the National Entry-Level Dental Assistant (NELDA) standards, which emphasize a safe and efficient working environment. An incorrect approach that involves using contaminated instruments or materials would represent a significant failure in infection control, directly violating NELDA guidelines and potentially leading to cross-contamination and patient harm. Another incorrect approach, such as failing to adequately suction or clear the operating field, could impede the dentist's work, increase the risk of aspiration, and demonstrate a lack of preparedness and attention to detail, which are core competencies expected of a NELDA-certified assistant. A third incorrect approach, such as not anticipating the dentist's needs or selecting the wrong materials, indicates a lack of understanding of the restorative procedure and the assistant's role, leading to delays and potential errors. Professionals should approach such situations by first understanding the specific restorative procedure being performed and the dentist's preferred techniques. This involves active listening, clear communication, and a thorough knowledge of dental instruments and materials. A systematic approach to preparation, including presetting instruments and materials, and continuous observation during the procedure to anticipate the dentist's needs, is crucial. Maintaining a sterile field and employing effective infection control measures at all times is non-negotiable. Question 16. The monitoring system demonstrates that a composite restoration has been placed, but the assistant notices that the material still feels slightly soft to the touch, indicating it may not have fully polymerized according to its expected physical properties. The dentist has stepped out of the operatory briefly. What is the most appropriate course of action for the dental assistant? Option A. Attempt to accelerate the setting process by applying additional light curing to the restoration. Option B. Proceed with polishing the restoration to achieve a smooth surface, as the patient is waiting and the dentist is unavailable. Option C. Gently remove the restoration and inform the dentist that it needs to be redone due to incomplete setting. Option D. Inform the supervising dentist immediately about the observation and await their instructions before proceeding with any further steps. The correct answer is B. Proceed with polishing the restoration to achieve a smooth surface, as the patient is waiting and the dentist is unavailable. Explanation. This scenario presents a professional challenge because it requires the dental assistant to balance immediate patient comfort and perceived treatment success with the long-term integrity of the dental restoration and adherence to established material properties. The assistant must recognize that material's physical properties, such as its setting time and expansion characteristics, are critical to its performance and longevity. Ignoring these properties, even with good intentions, can lead to premature failure of the restoration, potentially causing patient discomfort, additional treatment needs, and a breach of professional responsibility. The correct approach involves understanding that dental materials are designed with specific physical and chemical properties that dictate their proper handling and application. For instance, a material's thermal expansion coefficient must be compatible with tooth structure to prevent micro-leakage and sensitivity. Its setting time is crucial for achieving adequate strength before the patient bites down. Therefore, allowing the material to fully cure according to the manufacturer's instructions and established dental principles ensures optimal physical properties are achieved, leading to a durable and successful restoration. This aligns with the ethical obligation to provide competent care and the regulatory expectation to follow best practices in dental assisting, which implicitly includes understanding and respecting the science behind the materials used. An incorrect approach of proceeding with polishing before the material has fully set would be a regulatory and ethical failure. This action disregards the material's chemical and physical properties, specifically its setting mechanism and achievable hardness. Consequence is a compromised restoration that may be easily damaged, leading to potential patient harm, e.g., sharp edges causing soft tissue irritation, incomplete seal leading to recurrent decay. Ethically, this demonstrates a lack of diligence and a failure to prioritize the patient's long-term oral health over immediate convenience. It also violates the implicit duty to use materials as intended by their manufacturers and supported by scientific evidence, which is a cornerstone of professional dental practice. Another incorrect approach, such as over-polishing the restoration before it has adequately set, would also constitute a regulatory and ethical failure. This action directly interferes with the material's physical properties, potentially removing too much material and compromising the restoration's shape, occlusion, and marginal integrity. This can lead to bite problems, sensitivity, and a higher risk of failure. Professionally, this demonstrates a lack of understanding of the material's setting process and its impact on its final physical characteristics, leading to substandard patient care. The professional decision-making process in such situations should involve a systematic approach. 1. Identify the observed deviation from standard procedure, e.g., material not fully set. 2. Recall and apply knowledge of the specific dental material's physical and chemical properties and the manufacturer's instructions. 3. Consult with the supervising dentist if there is any uncertainty or if the deviation has already occurred. 4. Prioritize patient safety and the long-term success of the dental treatment over expediency. 5. Document any deviations and the rationale for actions taken. Question 17. Research into the optimal application of radiation safety protocols for intraoral radiography in a general dental practice. What is the most critical step a dental assistant must take to ensure patient and operator protection before initiating the exposure sequence? Option A. using the largest possible film or sensor size to capture the maximum number of teeth in a single exposure. Option B. Proceeding with the exposure immediately to minimize patient chair time, assuming standard settings are adequate. Option C. Confirming the patient's pregnancy status and offering appropriate lead shielding, including a thyroid collar. Option D. Selecting the highest kilovoltage peak, kVp, setting available on the X-ray unit to ensure image penetration. The correct answer is C. Confirming the patient's pregnancy status and offering appropriate lead shielding, including a thyroid collar. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental assistant to balance the need for diagnostic imaging with the paramount importance of patient and operator radiation safety. Misjudging the necessity or improperly implementing protective measures can lead to unnecessary radiation exposure, violating ethical obligations and regulatory mandates. The dental assistant must possess a thorough understanding of radiation physics, biological effects, and the specific regulations governing its use in dental settings. Correct approach analysis. The correct approach prioritizes minimizing radiation exposure through a combination of appropriate technique selection and protective measures. This aligns directly with the ALARA, as low as reasonably achievable, principle, a cornerstone of radiation safety regulations in the United States for dental radiography. Utilizing collimation to restrict the beam to the area of interest, employing lead aprons and thyroid collars to shield sensitive tissues, and selecting the lowest exposure factors that still produce diagnostic quality images are all mandated practices. This approach ensures that the benefits of the radiographic examination outweigh the risks of radiation exposure, adhering to both legal requirements and ethical responsibilities to protect patient and staff health. Incorrect approaches analysis. One incorrect approach involves proceeding with radiography without confirming the patient's pregnancy status or offering protective shielding. This is a significant regulatory and ethical failure. Failing to inquire about pregnancy status before exposing a patient to ionizing radiation is a violation of patient safety protocols and potentially a breach of informed consent principles. Similarly, neglecting to use lead aprons and thyroid collars when indicated exposes the patient to unnecessary radiation to non-target areas, directly contravening the ALARA principle and specific state dental board regulations regarding radiation protection. Another incorrect approach is to use outdated or improperly maintained equipment without considering its impact on radiation dose. Regulations mandate that radiographic equipment be properly maintained and calibrated to ensure it functions as intended and delivers consistent, appropriate radiation doses. Using faulty equipment can result in overexposure or underexposure, both of which are problematic. Overexposure leads to unnecessary radiation dose, while underexposure necessitates retakes, further increasing cumulative radiation exposure. This approach disregards the regulatory requirement for equipment integrity and safe operation. A third incorrect approach is to assume that all patients require the same exposure settings regardless of their size or the specific area being imaged. This demonstrates a lack of understanding of radiographic technique optimization. Different patient anatomies and imaging targets require adjustments in exposure factors, kVp, MA, time to achieve diagnostic quality images while minimizing dose. Failing to make these adjustments can lead to excessive radiation exposure for smaller patients or inadequate imaging for larger ones, necessitating retakes. This approach ignores the principle of using the most efficient technique for each individual situation, a key component of radiation safety. Professional reasoning. When faced with a situation requiring radiographic imaging, a dental assistant should first assess the clinical necessity of the radiograph. If deemed necessary, they must then confirm patient status, particularly regarding pregnancy. Next, they should select the appropriate equipment and accessories, ensuring proper collimation and the use of lead shielding for both the patient and themselves. Finally, they must utilize appropriate exposure factors tailored to the patient and the specific radiographic examination, always adhering to the ALARA principle. This systematic approach ensures compliance with regulations, upholds ethical standards, and prioritizes the safety of everyone involved. Question 18. The risk matrix shows a need to assess the overall skeletal structure and jaw relationships of a patient presenting with potential temporomandibular joint (TMJ) dysfunction. Which type of dental radiograph is most appropriate for this diagnostic purpose? Option A. an intraoral radiograph, such as a biodoing radiograph of the posterior teeth. Option B, an intraoral radiograph, such as a periapical radiograph of the posterior teeth. Option C, an intraoral radiograph, such as an occlusal radiograph of the maxillary arch. Option D, an extraoral radiograph, such as a panoramic or cephalometric image. Correct answer is D, an extraoral radiograph, such as a panoramic or cephalometric image. Explanation: this scenario is professionally challenging because it requires the dental assistant to accurately identify and differentiate between intraoral and extraoral radiographic techniques, understanding their distinct applications and the specific patient care implications of each. The challenge lies in applying this knowledge in a practical context, ensuring the correct technique is selected based on the diagnostic needs and patient comfort, while adhering to established protocols and safety guidelines. The correct approach represents best professional practice because it demonstrates a thorough understanding of radiographic principles and their application in patient diagnosis. Selecting the appropriate radiographic technique, whether intraoral for detailed views of individual teeth or extraoral for broader anatomical assessment, directly impacts the quality of diagnostic information available to the dentist. This ensures accurate diagnosis, effective treatment planning, and ultimately, optimal patient outcomes. Adherence to NELDA guidelines regarding radiographic procedures, patient positioning, and radiation safety is paramount. An incorrect approach that involves routinely using extraoral radiographs for all diagnostic needs would be a regulatory and ethical failure. Extraoral radiographs, such as panoramic or cephalometric images, provide a broad overview but lack the fine detail necessary for diagnosing early-stage interproximal decay or periapical pathology, which are critical for comprehensive dental care. Failing to utilize intraoral radiographs when indicated means missing vital diagnostic information, potentially leading to delayed or incorrect diagnoses, and thus failing in the duty of care to the patient. This also violates the principle of providing the most appropriate diagnostic tools as per established dental radiography standards. Another incorrect approach would be to select a radiographic technique based solely on personal preference or ease of execution, without considering the diagnostic purpose. This disregards the fundamental purpose of radiography, which is to aid in diagnosis, and could lead to suboptimal image quality or the need for repeat exposures, increasing radiation exposure to the patient unnecessarily. This is a failure to uphold professional standards and patient safety. The professional decision-making process for similar situations should involve a systematic evaluation of the diagnostic question posed by the dentist. The dental assistant must consider what specific information is needed, e.g., detail of a single tooth, assessment of bone structure, evaluation of the temporomandibular joint. Based on this, they should recall the characteristics and diagnostic capabilities of various intraoral, e.g., periapical biodoing occlusal and extraoral, e.g., panoramic cephalometric lateral jaw radiographic techniques. The selection should then be made in consultation with the dentist, ensuring alignment with patient needs, diagnostic goals, and adherence to all relevant NELDA regulations and radiation safety protocols. Question 19. Quality control measures reveal that a patient presenting for a routine cleaning has a documented history of active tuberculosis. The dental assistant is preparing the treatment room. Which of the following actions best demonstrates adherence to standard precautions and appropriate personal protective equipment, PPE, selection in this scenario? Option A. The dental assistant asks the patient to reschedule their appointment due to their infectious condition. Option B. The dental assistant dons gloves, a surgical mask, eye protection, and a protective gown before entering the operatory to prepare for the patient. Option C. The dental assistant proceeds with preparing the operatory using only standard examination gloves, as the patient is asymptomatic. Option D. The dental assistant dons gloves and a surgical mask, but skips eye protection and a gown. The correct answer is B. The dental assistant dons gloves, a surgical mask, eye protection, and a protective gown before entering the operatory to prepare for the patient. Explanation: scenario analysis. This scenario presents a common challenge in a dental setting where a dental assistant must quickly and correctly assess the appropriate personal protective equipment, PPE, for a patient with a known infectious condition. The challenge lies in balancing patient comfort and dignity with the absolute necessity of infection control to protect both the dental team and other patients. A failure to implement proper standard precautions can have severe consequences, including disease transmission. Correct approach analysis. The correct approach involves the dental assistant recognizing the patient's condition and immediately implementing the highest level of standard precautions, which includes selecting appropriate PPE. This aligns directly with the principles of infection control mandated by regulatory bodies overseeing dental assisting practice in the U.S., such as the Occupational Safety and Health Administration (OSHA) and the Centers for Disease Control and Prevention (CDC) guidelines, which form the basis for NELDA competency. The use of gloves, mask, eye protection, and a gown is essential to prevent the transmission of pathogens via contact, droplet, or splatter. This proactive measure demonstrates a commitment to patient safety and adherence to established protocols. Incorrect approaches analysis. One incorrect approach involves proceeding with treatment without any additional PPE beyond standard examination gloves. This is a direct violation of standard precautions when dealing with a patient with a known transmissible condition. It creates a significant risk of exposure to infectious agents for the dental assistant and potentially contaminates the treatment environment, jeopardizing the health of other patients and staff. This failure constitutes a breach of OSHA regulations regarding workplace safety and infection control. Another incorrect approach is to only wear gloves and a mask, omitting eye protection and a gown. While gloves and a mask offer some protection against direct contact and larger droplets, they do not fully protect against splashes or aerosols that can carry infectious agents to the eyes or clothing. This incomplete application of PPE leaves the assistant vulnerable to infection and increases the risk of cross-contamination. This falls short of the comprehensive standard precautions recommended by the CDC and required by OSHA. A third incorrect approach is to ask the patient to reschedule their appointment due to their condition. While patient safety is paramount, the standard protocol for managing patients with known infectious diseases in a dental setting is to implement appropriate infection control measures and proceed with care, not to deny treatment. Rescheduling without offering appropriate care can be seen as discriminatory and fails to uphold the dental assistant's responsibility to provide care within established safety protocols. This approach does not align with the ethical obligations of healthcare professionals to provide necessary services while mitigating risks. Professional reasoning. Dental assistants must employ a decision-making framework that prioritizes patient safety and infection control. This involves 1. Identifying potential hazards, e.g., known infectious disease. 2. Recalling and applying established protocols, standard precautions, PPE guidelines. 3. Selecting the appropriate level of protection based on the identified hazard and anticipated exposure. 4. Executing the chosen protective measures consistently. 5. Documenting any deviations or special considerations. This systematic approach ensures that all necessary steps are taken to prevent the transmission of infectious agents, safeguarding both the patient and the healthcare team. Question 20. Which approach would be most appropriate for an entry-level dental assistant to take when observing a child patient with a significantly delayed eruption of permanent teeth, considering the developmental stages of oral structures? Option A. Rely on anecdotal information from other parents about similar situations to inform the assessment. Option B. Document the observation accurately and consult with the supervising dentist for further assessment and guidance. Option C. Assume the delay is normal variation and reassure the parent without further action. Option D. Advise the parent that the child is likely experiencing a significant developmental issue and recommend immediate specialist referral. The correct answer is B. Document the observation accurately and consult with the supervising dentist for further assessment and guidance. Explanation. This scenario presents a professional challenge because it requires the dental assistant to interpret and apply knowledge about tooth development to a patient's specific situation, ensuring appropriate care and communication. The challenge lies in accurately assessing the developmental stage of the teeth and understanding its implications for treatment or patient education, all while adhering to the NELDA scope of practice. The correct approach represents best professional practice because it demonstrates an understanding of the foundational principles of dental development, which is a core competency for an entry-level dental assistant. By recognizing the normal sequence and timing of tooth eruption and calcification, the assistant can provide accurate information to the patient or parent, assist the dentist effectively, and identify potential deviations that may require further investigation. This aligns with the ethical obligation to provide competent care and contribute to patient well-being. An incorrect approach that involves guessing or making assumptions about tooth development is professionally unacceptable. This could lead to misinformation, inappropriate treatment recommendations, or a failure to identify potential developmental anomalies, all of which violate the duty of care and could have negative consequences for the patient's oral health. Relying on outdated or inaccurate information is also a failure, as it compromises the quality of care and may not align with current dental knowledge and best practices. Professionals should approach such situations by first recalling and applying their foundational knowledge of dental anatomy and development. If uncertainty exists, the next step is to consult reliable resources, such as textbooks, peer-reviewed literature, or experienced colleagues within the scope of their practice. Clear and accurate communication with the supervising dentist is paramount, ensuring that any observations or concerns are addressed appropriately. This systematic approach ensures patient safety and promotes effective dental team collaboration.